All right, so today we're diving deep into the world of Dr. Birru and how they approach taking care of the cardiovascular system.
Ooh, exciting.
Yeah, we've got a bunch of their materials to work with, too. Lecture notes, diagrams, even some of their research papers.
Oh, wow.
We can really get a feel for how Dr. Birru thinks.
Yeah.
Our goal is to understand how they diagnose and treat common heart conditions,
Okay.
especially acute coronary syndrome.
Yeah, that's a tricky one for sure.
Definitely. And you know what I think is interesting?
What's that?
Is that Dr. Birru really starts with a strong foundation.
Yeah.
They don't just jump into the complicated stuff.
Right. They give us a clear picture of how the whole cardiovascular system works first.
Exactly, before getting into the specifics. So just to set the stage, can you remind me,
Sure.
what's the core problem with cardiovascular disease in the first place?
Well, with cardiovascular disease, it all comes down to the heart and the blood vessels.
Okay.
And when those aren't working properly, it can really impact your entire body. Wow. But Dr. Birru really focuses specifically on coronary artery disease, or CAD, where the arteries that supply blood to the heart itself get compromised.
Oh, so it's the heart's own blood supply.
Exactly.
That gets messed up.
Right.
Okay, so CAD is like the big bad wolf in this story.
Yeah, I think that's a good way to put it.
And then Dr. Birru breaks it down further, right?
They do.
Into different types of CAD.
Yeah, they highlight stable angina.
Okay.
And then the more serious one is acute coronary syndrome.
ACS.
ACS, that's right.
But before we even get into those,
Yeah.
I was looking through Dr. Birru's notes,
Mm.
and it's interesting how much emphasis they put on understanding the patient's story.
Oh, absolutely.
Like their individual experience. They even have a list of specific questions that they ask to really understand what the person's chest pain is like.
Interesting. So it's not just about test results for Dr. Birru.
It seems like it. No.
They really value the patient's perspective.
Yeah. It's like they're a medical detective.
I like that.
Looking for clues.
Yeah, what kind of clues are they looking for?
Well, they want to know the exact location of the pain.
Okay.
What it feels like, how long it lasts, and if it goes away with rest or medication.
Right.
So all those little details help them figure out
to determine
if it's stable angina or something more serious.
That makes sense.
So let's actually talk about stable angina for a second.
Okay.
Dr. Birru uses this great example of what happens when you're working out.
Oh, yeah.
Right, your heart's pumping, needing more oxygen. But what happens if those arteries are kind of...
clogged.
Yeah, clogged.
That's the problem with stable angina right there.
Okay.
So think of your arteries like highways.
Okay.
Normally, blood flows freely.
Yeah.
Delivering oxygen to your heart.
Okay.
But with atherosclerosis, it's like rush hour traffic.
Oh.
You've got plaque building up in the arteries, narrowing them and restricting blood flow. Okay. So when your heart needs more oxygen, like when you're exercising, that restricted flow causes chest pain.
The heart's not getting enough.
Exactly.
Wow, that traffic analogy really helps.
Well, that helps.
So basically, stable angina is chest pain.
Yeah.
That's predictable.
Yeah.
It's triggered by exertion.
Right.
And it's relieved by rest.
Yes.
Or medication.
You got it.
Yeah.
And Dr. Birru really stresses that understanding the difference between stable angina and acute coronary syndrome is crucial because the treatment is drastically different.
That makes sense.
It's like knowing when to take an aspirin versus calling 911.
Oh, for sure. Big difference.
Huge.
So what about those risk factors for stable angina?
Yeah.
Dr. Birru talks about those too, right?
Oh, absolutely. They break them down into two categories.
Okay.
Modifiable and non-modifiable.
Okay. So things you can change.
Right. And things you can't.
So think about your daily routine,
Yeah.
Are you getting enough exercise?
That's a big one.
Is your diet heart healthy?
Definitely smoke. All of those are modifiable risk factors.
Okay.
And Dr. Birru really highlights that you have the power to make changes that directly impact your risk.
Well, that's awesome.
For heart disease.
I like that it's empowering.
It is.
But what about the things you can't change?
Right.
Like your family history?
Those are the non-modifiable risk factors.
Right.
Things like age, genetics, ethnicity.
Yeah.
Those are things you can't control.
Okay.
But Dr. Birru doesn't present this information to make you feel powerless.
Right.
Instead, they emphasize that knowing your risks, both modifiable and non-modifiable, allows you to be more proactive about your heart health.
So it's like if you know you have a family history of heart disease.
Exactly.
You can be extra careful about the choices you make.
You can double down on those healthy habits.
And it sounds like Dr. Birru actually practices what they preach.
Oh, for sure.
I mean, their notes even mention that they routinely talk about these risk factors with their patients.
They do.
And really encourage them to make changes.
Mm-hmm. They're not just treating the disease, they're helping people prevent it.
I like that.
Me too.
So for Dr. Birru, it's not just about treating the disease, it's about empowering patients to prevent it.
Absolutely. A very proactive and holistic approach.
Yeah, I like that a lot. Okay.
Mm-hmm.
So we talked about stable angina.
Right.
But then there's acute coronary syndrome.
ACS.
ACS.
Whole different ballgame.
And Dr. Birru really drives home the point that ACS is a medical emergency.
Oh, yeah.
There's no waiting around to see if it gets better.
Nope, you need to act fast.
Absolutely. So how does Dr. Birru categorize ACS?
They categorize it as a spectrum of conditions.
Okay.
From unstable angina to myocardial infarction.
Which is basically a heart attack.
Exactly.
Okay, so let's unpack that a bit. What makes unstable angina different from stable angina?
Well, unstable angina is like stable angina's unpredictable cousin.
Okay.
Remember that rush hour traffic analogy we talked about?
Yeah, with the clogged arteries.
Right. Well, with unstable angina, it's like a sudden, unexpected pileup on the highway.
Oh, no.
It's often a sign that something more serious is happening.
Like what?
Like a blood clot forming. Or a piece breaking off and blocking blood flow to the heart.
So it's not just the plaque buildup anymore.
It's not. It's like the plaque has become unstable.
That sounds pretty scary.
It can be.
So with unstable angina, the chest pain isn't always tied to exertion.
Right. It can happen even at rest.
And it might not go away with rest or medication.
Exactly. And this is where Dr. Birru is really clear.
About what?
If you or someone you're with experiences chest pain that's new, worsening, or doesn't respond to nitroglycerin, call 911. Don't wait to see if it gets better on its own.
Got it. No toughing it out.
Nope. This is serious.
So unstable angina is basically a huge red flag.
It is. It's your body telling you something is wrong.
And you need to get help immediately.
Exactly.
And this is also where Dr. Birru's emphasis on diagnostic tools comes in.
Oh, yeah. They're big on using technology to get a clearer picture.
Like what specifically?
Well, they specifically mention the importance of an EKG.
Okay.
Which can show changes that might indicate unstable angina or even a heart attack.
So it's not just about listening to the patient's symptoms.
It's not. It's about using technology to confirm what's happening inside the heart.
Okay, so it's like combining the patient's experience with the technology.
Exactly. That seems to be a key part of Dr. Birru's approach.
Very cool.
It is.
So we've got stable angina,
right,
unstable angina, and then the really scary one, myocardial infarction.
A heart attack.
Yeah, what does Dr. Birru have to say about that?
Well, they emphasize that time is of the essence with a heart attack.
Okay.
Every second counts.
And they actually use this term.
What term?
Code STEMI.
Oh, yeah. Have you heard of that?
Code STEMI sounds intense.
It is. It's like a hospital-wide alert system.
Oh, wow.
That signals that a patient with a STEMI heart attack needs immediate attention.
STEMI. So are there different kinds of heart attacks?
Good question. Dr. Birru breaks it down into two main types. Okay.
NSTEMI and STEMI.
Oh.
Both involve damage to the heart muscle because of blocked blood flow.
Yeah.
But STEMI is generally more serious because it involves a complete blockage of a major artery.
Okay, so STEMI is the one that triggers the code.
Right, because it's the most urgent situation.
And every second counts.
Absolutely.
So what about NSTEMI then? How is that treated?
Well, Dr. Birru points out that even though NSTEMI is a partial blockage, it still needs prompt treatment.
Okay.
They often recommend medications to manage symptoms, reduce the workload on the heart, and prevent further clotting.
So kind of like a less intense version of STEMI?
In a way, yeah, but it still needs to be taken seriously.
Got it. So whether it's STEMI or NSTEMI, Dr. Birru is all about acting fast.
Absolutely.
And tailoring the treatment to the specific situation.
It's not one size fits all.
No, definitely. Okay, so we've got these different types of heart attacks.
Right.
But it sounds like Dr. Birru doesn't just focus on the immediate crisis. They also talk about the importance of long-term management.
Okay.
After a heart attack.
So like what kind of stuff?
They mention things like lifestyle changes, medication, and regular follow-up appointments.
So it's about preventing future heart attacks.
Exactly, not just treating the current one.
I like that a lot.
Me too.
Okay, so we've talked about angina.
Right.
Both stable and unstable. And then we talked about the two main types of heart attacks.
And STEMI and STEMI.
and Dr. Birru's approach to treating those.
Yeah, we've covered a lot of ground.
We have, but I think we've only just scratched the surface.
Oh, there's so much more to explore.
Yeah, there is. Like, what about sudden cardiac death?
Oh, yeah, that's a big one.
And all the things people can do to prevent heart problems in the first place.
Absolutely.
So much to talk about.
Definitely.
Well, I think that's a good place to stop for now.
Okay.
We'll pick up where we left off in the next part of our deep dive into Dr. Birru's approach to cardiovascular care.
Sounds good. I'm looking forward to it.
Me too.
All right.
See you then.
So before we went to, that little break there, we were talking about unstable angina.
Yeah.
And how Dr. Birru really stresses that it's a red flag.
Yeah, you need to get help.
Totally. But they don't just, leave us hanging there.
Right.
They actually walk us through what happens when someone shows up at the hospital with unstable angina.
Okay.
And it's like a well-oiled machine.
Oh, really?
Everyone knows exactly what to do.
That's good. So there's a plan.
Oh, yeah, definitely. And there's a real sense of urgency in Dr. Birru's instructions, but also a calmness,
Okay.
They emphasize getting a good history from the patient.
Okay, so those same detailed questions.
Yeah, those same ones we talked about, but also quickly moving to diagnostic tests like an EKG and blood work.
So they're listening to the patient.
Yes.
But also gathering all the scientific evidence.
Exactly, as fast as possible.
Got it.
And then they describe the medications they typically use for unstable angina, which are aimed at stabilizing the situation and preventing a full-blown heart attack.
Okay, so the medications are key here.
Oh, yeah, for sure.
So what are we talking about? Are we talking aspirin, nitroglycerin?
Those are definitely part of the toolkit.
Okay.
Dr. Birru explains that aspirin helps prevent blood clots from forming, while nitroglycerin works to relax and widen those arteries so it improves blood flow to the heart.
Okay, so aspirin for the clots, nitroglycerin to open things up.
Yep. But they also talk about more powerful medications like heparin.
Oh, heparin.
Which acts faster to prevent clotting.
That's the one that needs really careful monitoring, right?
It is. You have to make sure the blood doesn't get too thin.
Yeah, you don't want people bleeding out.
Exactly. And Dr. Birru's notes are super meticulous about dosing and monitoring.
Okay.
It makes me think they're very aware of the potential risks and benefits of each medication.
Makes sense.
They even mention a rare but serious complication called HIT.
HIT.
Heparin-induced thrombocytopenia.
Oh, my goodness.
Where the body actually starts to destroy platelets.
Really?
In response to the heparin.
Wow, that's wild.
It is. It's a pretty serious situation.
So Dr. Birru is not afraid to use these powerful medications.
No, they're not.
But it sounds like they're very cautious and attentive to the potential problems.
Oh, absolutely. They're walking a tightrope between helping the patient and making sure they're not harmed by the treatment.
Yeah, that's a tough balance.
It is for sure. But Dr. Birru also seems to have a good sense for when a less invasive approach might be better.
Okay.
They mentioned something called PCI.
PCI.
Percutaneous coronary intervention.
Okay.
It's a procedure that uses a tiny balloon to open up a blocked artery in the heart.
Oh, I've heard of that. It's like a tiny angioplasty.
Exactly.
Okay.
And Dr. Birru often recommends this as an early intervention for unstable angina.
So instead of just managing the symptoms?
Right, they actually go in and try to fix the problem.
I like that proactive approach.
It's potentially life-saving.
But PCI isn't always an option, right?
Okay. It's not. And that's where we start to move into the realm of myocardial infarction or MI, what we commonly call a heart attack.
Okay, so this is like the big kahuna.
It is the most serious form of acute coronary syndrome.
So what does Dr. Birru tell us about MI?
Well, they really emphasize that time is of the essence.
Okay.
They even use that term code STEMI.
Code STEMI.
It's a hospital-wide alert system that signals a patient with a STEMI heart attack needs immediate attention.
Okay, so every second counts.
Absolutely. The goal is to get that patient into the cath lab for PCI as quickly as possible to restore blood flow.
Wow, so you mentioned STEMI. Are there different kinds of heart attacks?
There are. Dr. Birru breaks it down into two main types, and STEMI and SEMI.
Okay.
Both involve damage to the heart muscle because of blocked blood flow.
Right.
But STEMI is generally more serious because it involves a complete blockage.
Of a major artery.
Yes.
Okay, so STEMI is the one that gets the code.
Right, because it's the most urgent situation.
Got it. What about in STEMI then? How is that handled?
Well, even though in STEMI is a partial blockage, it still needs prompt treatment.
Okay.
Dr. Birru often recommends medications to manage symptoms, reduce the workload on the heart, and prevent further clotting.
So it's like a less intense version of a STEMI.
You could say that, but it still needs to be taken very seriously.
Okay, so whether it's STEMI or NSTEMI, Dr. Birru is all about quick action and a tailored approach.
Exactly. It's not one size fits all.
Okay, I like that.
And they don't just focus on the immediate crisis either.
Oh, okay. So what else?
They talk about the importance of long-term management after a heart attack.
Oh.
Things like lifestyle changes, medication, and regular follow-up appointments.
So it's about preventing future heart attacks.
Absolutely not. Just treating the current one.
That makes a lot of sense.
It does.
Okay, so we've got PCI as an option.
Right.
We've got medications.
Mm-hmm.
What other tools does Dr. Birru have in their arsenal for treating heart attacks?
Well, especially for STEMIs, there's something called thrombolytic therapy.
Thrombolytic therapy.
It's sometimes called clot-busting medication.
Oh, yeah. I remember this.
It's given intravenously to dissolve the blockage and restore blood flow.
And it's usually used when they can't get someone to a cath lab for PCI fast enough.
Exactly. It can be a real lifesaver, especially in rural areas where access to PCI might be limited.
But it's a risky treatment, right?
It is. There's a potential for serious bleeding.
So Dr. Birru only uses it in very specific situations.
They do when the benefits outweigh the risks?
Because every situation is different.
Oh.
Okay, so it's a powerful tool, but it needs to be used carefully.
Absolutely. And this is where Dr. Birru's attention to detail really shines.
Okay, how so?
They outline these really strict protocols for monitoring patients after thrombolytic therapy,
Okay.
checking for bleeding and managing any complications that might arise.
So they're on top of it.
Oh, yeah. They don't mess around when it comes to patient safety.
So Dr. Birru's approach to heart attacks is like a multi-pronged strategy.
I think that's a great way to put it.
Quick diagnosis,
Mm-hmm.
tailored treatment, focus on immediate intervention and long-term prevention.
They've got it all covered.
It's really impressive.
It is. They're a very thorough doctor.
Okay, so we've talked about treating heart attacks,
Right.
but what about the potential complications that can happen afterwards?
Oh, yeah. Those are important to consider, too.
So what does Dr. Birru say about those?
Well, they delve into things like heart failure, arrhythmias, even sudden cardiac death.
Sudden cardiac death. That one sounds particularly scary.
It is. It seems like it comes out of nowhere.
Yeah, just all of a sudden.
But even though it seems sudden, Dr. Birru points out that it often has underlying causes.
Like what?
Like those same risk factors we talked about earlier.
So the same things that put you at risk for a heart attack can also increase your risk for sudden cardiac death.
Exactly. It's all connected.
Okay, that's a good reminder to be proactive about our heart health no matter what.
I agree with that completely. And you know what?
What's that?
Dr. Birru's notes actually include a whole section on preventative measures.
Oh, so things you could do to reduce your risk.
Exactly, even if you've never had a heart attack.
So it's not all doom and gloom.
It's not. There are things we can do to protect our hearts.
Okay, I like that. So we'll dive into those preventative measures.
Yes, let's talk about how to keep those hearts healthy.
Sounds good to me. Okay, so we're back and ready to talk about prevention. Because I don't know about you, but I really don't want to end up in the ER with a heart problem.
Me neither. And, that's something Dr. Birru really emphasizes throughout their materials, this idea that knowledge is power when it comes to our hearts.
Oh, I like that. So we're not just at the mercy of our genes or bad luck.
Nope. We can make choices that protect our hearts.
Okay, that's encouraging. So spill the beans. What does Dr. Birru recommend?
Well, they're not just giving vague advice like eat healthy and exercise.
Okay, good, because we hear that all the time.
Right. They get specific, like they really highlight the importance of managing cholesterol levels.
Oh, yeah, cholesterol. That's a big one.
It is. And they specifically talk about lowering LDL cholesterol, the bad kind,
Okay.
and raising HDL cholesterol, the good kind.
So it's not just about cutting out all fat.
Right. It's about understanding the different types of fat and how they impact our hearts.
Yeah, I remember Dr. Birru mentioning that even some seemingly healthy fats, like in coconut oil, can actually raise LDL.
Exactly. It's all about the details. And they go beyond diet, too.
Oh, okay, like what?
Well, they talk about regular exercise, of course, aiming for at least 30 minutes of moderate intensity exercise most days of the week.
Okay, that's doable.
Right. But they also emphasize that even small bouts of activity throughout the day can add up.
Oh, that's good to know. So it's not about running a marathon every day.
Nope. It's about moving our bodies more consistently.
I like that.
And of course, they talk about quitting smoking.
Oh, yeah, that's a big one.
Definitely no brainer there.
But it's not always easy to quit. I wonder if Dr. Birru addresses that.
They mention that they always offer their patients resources and support to help them quit.
Oh, that's good to hear.
They even sometimes prescribe medications to help with cravings and withdrawal.
So they're really there for their patients every step of the way.
Oh, it seems like it.
That's awesome. Okay, so we've got diet, exercise, quitting smoking.
Yep, those are the biggies.
Anything else?
Well, Dr. Birru also talks about managing stress.
Oh, stress. That makes sense.
It does. Chronic stress can really wreak havoc on our hearts.
How so?
It raises blood pressure, increases inflammation, and that can damage our arteries over time.
So what's the antidote to stress? What does Dr. Birru recommend?
Well, they suggest things like exercise, meditation, spending time in nature, connecting with loved ones.
Okay, so things that help us relax and unwind.
Exactly. It's about finding what works for you and making it a regular part of your life.
Yeah, that makes sense. And you know what else I was surprised to see in Dr. Birru's notes?
What's that?
The importance of sleep.